here with Body Radiosurgery. Hey, Dr. Lederman, we're back.
Yes, we're back. We're here to take your calls. We're live at ABC Studios. Our number, if you want to call, is 800-848-WABC, which is 800-848-9222. 800-848-9222. We had some interesting patients during the week, and I wanted to discuss some of them because we can always learn from every interaction. I mean, the more you're looking to learn, the more you will learn. One patient called me just yesterday who was diagnosed with melanoma in the past on their arm and had metastasis to the axilla. Okay. And they got a CAT scan and sent me the CAT scan. And the CAT scan showed, when I reviewed it, that there were enlarged masses in both adrenal glands. So they asked me if we can treat the axilla for melanoma, and the answer is yes, of course we can treat the axilla. But what about the adrenal glands? And I said, really, normally I would get a PET scan to stage. I think PET scan is more sensitive than just a regular CAT scan. And the question really for that patient is whether they should have surgery on the axilla or whether they should have radiosurgery. And I said I'd first get staged up because if they have other areas, they may want to not have surgery because the surgery is obviously not going to cure them. They may want to do radiosurgery, which is 5 outpatient treatments, and consider the other sites as well.
Absolutely.
We have a call from Stephen in New Hyde Park who has throat cancer, lots of swelling, and difficulty swelling, and what to expect. Good morning, Stephen. How are you today?
Good morning, doctor. Very good show. I love your show. I've been diagnosed in February with throat cancer.
I'm sorry to hear that.
Yes. So they gave me a chemo radiation, and that ended over a month ago. I got a lot of difficulty swallowing. My throat feels very tight, and my salivary glands a lot of dry mouth. I'd like to know what to expect in the future months and what I should do from now here on in.
Well, there's new technologies, actually, for prevention of dry mouth from head and neck radiation. So cancers of the head and neck area, like the throat, the mouth, the tongue, voice box, are considered head and neck. And there are new technologies to minimize dry mouth, and that is to avoid the parotid glands. The parotid glands are on either side of the face near the ears, and standard radiation hits those and dries them out. So new technologies don't. Unfortunately, in you, we can't go back in time. Most likely, your soreness and your soreness will probably get better with time. I mean, you're probably in the peak period, and you probably should be getting better every week. I hope that you're getting better every week. And then you need to get follow-up examinations, both with your throat doctor, and I usually get, again, PET scans because they're very sensitive and show things even before the throat doctor can diagnose things. And there are some medicines to stimulate the salivary glands and try to get back. So I wish you well and hope you have a complete recovery and get back to your normal self and are cancer-free. And again, that's cancer very commonly is associated with smoking. So if you're still smoking, you should really try to stop that. And if you never smoked, thank God. And for all the other smokers out there, it's a sign that you may want to just try to cut back or stop because you will decrease your risk of cancers and heart disease if you stop today. We had some other interesting cases during the week. I talked about this man who had esophageal cancer, this very distinguished businessman, and he had one solitary site in his lymph nodes in the aorta, and he had his 5 treatments. He finished yesterday, and he did perfectly. He had no side effects. He went out and had a pastrami sandwich afterwards, which I wish I was able to go with him for that pastrami. And we're going to get follow-up scans and examine him over the months and years to come. So we wish him well as well. One person called me and said, well, what do you do for prostate cancer? What's your formula? And because there's many places like do proton beam. You walk in there, you know you're going to get 45 proton beam treatments. You go to CyberKnife, you're going to get that. And we don't have one program because different men have different desires.
Right.
Different men have different prognoses. Some have low risk, some have high risk, and some want a treatment in one shot, 45 minutes, and they're out the door. And that's a great treatment for many, many men. That you can imagine one treatment versus 45 is very appealing.
No-brainer.
And most men are busy working, and they want to care in their life, and they want to keep their sex life, they want to keep their urinary life. And I would suspect that compared to surgery especially, which the majority of the men have adverse effects, and not everyone, unfortunately, even makes it through the surgery. Brachytherapy is an easy method. We've been doing it for decades. We've done thousands of cases. So I said it depends what you want. You really need to come in and we talk about, do you want the quickest treatment? Do you want the longest treatment? Do you want this technology, that technology? And so it's not an easy answer. And often I will spend an hour or 2 hours with a patient. We're kind of a boutique place, so we don't spend 2 minutes. We try to spend an hour or two and answer all the questions, and I give the patient my cell phone. And I think people go away feeling that they can know more about their cancer and ask the questions as follow-up. I tell them to call day or night.
It's very important.
We have a man, Joseph from Queens, who said his holistic doctor said to stay away from sugar. So good morning, Joseph. How are you today?
Good morning, doctor. I went to a holistic doctor who took my blood, and he was telling me that cancer is attracted to sugar. He said stay away from all sugars. And when I tell my oncologist is in total conflict with that. And I'm totally torn. I want to keep eating sugar.
The problem is that, people are looking for simple solutions. And if cancer isn't effectively treated, if you don't cure your cancer, the cancer is going to start eating calories. And you can have no sugar. So what happens if you have no sugar in your diet? Well, it's going to eat your muscles. It's going to eat your fat. It's going to eat every substance in your body to stay alive because it's a fight between your cancer and your body. And there's no study that has ever shown that if you avoid sugar, you're going to live longer. So we talked about it last week with vitamins and megavitamins and antioxidants. There's no studies. In fact, the people that take vitamins, megavitamins, and antioxidants die at a faster rate than if you wouldn't. So all these cockamamie ideas about no sugar and take so many vitamins, antioxidants, actually people are doing themselves in rather than living longer. So I would just urge you to get effective therapy, get the most effective therapy, and exercise, eat a good diet, a healthy diet, stop smoking. And studies have shown that for typical Americans, if you exercise, eat a good diet, stop smoking, you'll reduce your chance of death by cancer by a substantial margin. So there is a randomized study that shows that. As far as the sugar, megavitamins, antioxidants, it's like patent medicines of 100 years ago when people were mixing up alcohol and cocaine and selling it to the population, often with poisons in, including arsenic and other things.
Did they really?
Yeah, it was a whole industry that 100 years ago took advantage of population, made a lot of money, and hurt a lot of people. And it was regulated. Eventually it was regulated. There were laws made to avoid patent medicines, that the ingredients had to be listed on the bottle. It couldn't be Dr. Joe's special herbal remedy for everything. And fortunately, people were prevented from that, but they haven't been prevented from the so-called vitamin industry. And I would just urge you, call me up during the week. I'm at 212-CHOICES, 212-CHOICES. I'm happy to speak to you about this or give you references about this. We don't want you to spend your money and your time and be misled, really waste your time on treatments that are so-called treatments that are useless. It's about the end of the hour. I'm here with Rob. I want to thank everyone. We have 2 shows tomorrow on WOR, which is 710 radio. One's at 6 to 7 a.m., and one is 9 to 10 p.m. Again, if you have questions during the week, just call us at 212-CHOICES, 212-CHOICES. If you want a booklet and a DVD, we send them out at no charge. Just call us up. Either call the radio station or, again, call the 212-CHOICES number. Thank you very much for listening. We're trying to provide new information like we did today and every week. So thank you. Have a great week and talk soon. Thank you, Rob.
Thank you, Dr. Lederman.
Thanks for tuning in to the Radiosurgery Hour with Dr. Gil Lederman and myself. If you have questions before next week's show, just contact Dr. Lederman at 212-CHOICES. That's 212-246-4237. That's 212-246-4237. This is Rob Redstone. Till next week.
This is where New York comes to talk. Legendary 77 WABC, New York, a Cumulus station.
From ABC News, I'm Dave Packer.